My name is Desiree Lakey. I am a program coordinator here at the North Carolina Office of Violence Prevention. Thank you all for joining us today for our webinar on using public data to inform community violence reduction with Dr. Ivan Benitez. So just a very quick kind of overview of our office for those of you who aren't familiar. We're a relatively newer office in state government housed out of North Carolina Department of Public Safety and supported with our partners of the Health and Human Services Department. When we were established, we were tasked with working to coordinate efforts across the state to reduce violence, harm from violence, and firearm misuse. And we work towards this mission by centering the public health approach, engaging cross-sector collaboration, and supporting local communities in deploying evidence-based programs and strategies. And as of right now, our office is narrowed in on community violence as its initial focus area for our efforts. And so that is a primary topic where we focus a lot of our events and training opportunities, like our webinars and conference. A few quick housekeeping things before we get started. We will have a formal Q&A at the end of Ivan's presentation, and you'll just use the chat to put any of your questions that you have there, and we'll go through those questions at the end of his presentation. And also, our webinar is going to be recorded, or it is being recorded right now. And so we will post that recording to our resource hub. If you don't know where that is, I'll happily share the link later on this webinar, but it will be recorded. So if you would like to go back to this information or have some colleagues who could benefit from this and couldn't attend today, you'll be able to share that information with them. All right, so diving into today's topic, as I mentioned, we'll be hearing from Dr. Ivan Benitez. Ivan earned his PhD from the University of Louisville in shortly after he joined their OVP as an Everytown Fellow. During his time as a fellow, Ivan developed Louisville's Gun Violence Dashboard, a vital tool for tracking and analyzing violent crime trends across various geographical levels. Ivan now serves as an executive administrator and head of OVP's Data, Innovation, and Special Projects Division, where he leads a team focused on integrating evaluation components into the organization's programs and initiatives. As many of us know, finding, accessing, interpreting, and using data for violence reduction efforts can certainly be overwhelming. So I'm really excited for you all to hear from Dr. Benitez on how he and his team developed their dashboard in Louisville, Kentucky, that made violent crime data more easily accessible and digestible for practitioners. So, Ivan, I will pass over to you.
Thank you very much, Desiree, and good morning, everybody. So I'll just use this slide as just a quick presentation or quick introduction to myself. So like Desiree was saying, I've been here for about 4 years now, and early on in my process at the Office of Violence Prevention, what my goal was to implement and integrate any kind of evaluation component to all of our programming that is internal and external. One of the biggest ones that we've seen some success with, which I'll be covering today, is the community violence intervention evaluation component. And a lot of that really was done, made possible by the accessibility of data being available to all community and residents within Jefferson County, and then of course it being publicly accessible to everybody. So yeah, that's kind of what we'll cover today. And we can go to the next one. So just kind of covering a little bit of the historic gun violence trends in Louisville. A lot of the times we focus on the gun violence peaking in 2021, but what we see in Louisville, or what we saw in Louisville, was that we had a peak also in 2016 and right after 2017 as well. So we had, if you can see in the figure on the right-hand side, the green indicates the homicides, and then the blue is the non-fatal So there were 2 years, 16 and 17, had triple-digit homicides as well. They kind of declined a little bit, but really our biggest peak was in 2021. And that, was pretty consistent with what we saw nationally right after the COVID-19 pandemic. And then, of course, like it leading from like a lack of trust in government, but also the police institution. And so, what we want to highlight here, specifically within Louisville, is that while we did have a peak in 2021 with over 800 shooting victims, we have seen a consistent reduction year over year over the last 4 years. And a major contributor to that is where we have prioritized our efforts. And in those priority areas, we continue to see those reductions just at a much higher rate than the citywide compared. We can go to the next slide. So as I was coming in back in 22, there wasn't really a way for gun violence to be tracked on a regular basis. Really, the only thing that was available was like maybe some media stuff and some reports from LMPD, Louisville Metro Police Department. But there wasn't really a way to like break it down more specifically to like location, and so that often led to maybe you could say a bit of a misinformation on like where gun violence was happening more readily. But the thing is though, and I'll show you all later, we do know that gun violence and crime particularly is concentrated in like certain areas within Jefferson County. But it's also easy at times to just overgeneralize and say, oh, well, it's happening all within the west end of Louisville, when really it's certain areas within even West Louisville that have experienced the highest rates of gun violence. And so that data being available to the public really made it accessible to dive deeper into where it is exactly that gun violence is concentrated, even within the areas that have been known to have higher rates of gun violence. The other thing that the data not being available led us to was having limitations on evaluating program effectiveness. Specifically when we were having ARP dollars being directed towards like community violence intervention efforts and not being able to determine whether those programs were effective or not made it a bit of a challenge to, in the near future and more recently, actually be able to justify any general funding towards CVI programs because that didn't exist at the time. And so like I mentioned before, that data wasn't ever really consistently available like at different levels. So, for example, neighborhood level here in Louisville is very important. We know that the neighborhoods that have been designated, we can break down the information by those. Zip codes or even council districts, a lot of time our council members want to know what's going on in their backyard. And so having this tool really allowed even council members to become a bit more, I would say, like engaged, but also informed about what's going on in their districts. And then, as I mentioned a while ago, yeah, just with data being exclusively like kind of within the reach of LMPD, it was really a bit of a challenge to for nonprofit organizations or even organizations like ourselves that are within Louisville Metro to actually be able to direct our services where they were needed. And so that was just a major limitation on what Louisville had recognized in needing gun violence to be more readily available. We can go to the next one. So as I was saying in the last slide, what this tool provided in filling the gaps was that direct violence intervention resources to the communities that were in greatest need of like our actual resources. Again, we know that west of 9th Street and really north of like Algonquin Parkway, we know that that's where like the violence is concentrated. But it's really just like throwing darts at a board where you're just hoping that it'll stick where it needs to be. But since then, we've been able to really address like the areas that are really needing our services. It also broke down silos even within our agency with other agencies within Louisville Metro, but even nonprofit organizations who were able to direct their funding and their resources towards areas that had needed just more resources in general. This really made it possible for us to be a bit more intentional about how we were funding organizations or why we were funding organizations. and then being able to show us that like, hey, like they're doing the work in the places that are needed the most, because we're going to see the greatest effect with those programs in the right areas. And then lastly, of course, just those grant opportunities and funding information being accessible to all organizations has been super helpful. We do get a lot of feedback just across the community where the tool has been helpful for them to be able to just fill out information for grants and saying that like we know that this is a need in this area because there have been this many shootings or this many homicides or whatever the case might be. But it's just a way for community to be tied into like what's going on in their community in their neighborhoods in order for them to be able to make data-driven decisions. And so we can think of the development of the dashboard, the gun violence dashboard, over a set of steps, right? So the first one was the funding source. At least for us at the time, it was a matching opportunity funded through ARP with Everytown for Gun Safety. So their goal was to find cities that at the time were kind of in a greater need for transparency when it comes to gun violence. So I was one of three fellows that was selected to work within their respective cities. So we had a fellow in Memphis, and then we had a fellow in Pittsburgh, and then myself here in Louisville, Kentucky. And so the three fellows were really given the same tasks in creating a type of dashboard or some kind of publicly accessible tool that would allow community to be more involved in just gun violence information for them to be able to make a difference and be involved within their landscape or their community in making a difference. The second step really consisted of working with LMPD's analytics teams, and that helped really define like the metrics, but also validate data that was maybe at times in question. And so, for example, I met with them early on in the process and asked them like, hey, how do you all make distinctions between, say, like non-fatal shootings, homicides, just giving or receiving all that information from the technicians, really, if you will, like that they see the data on the backside, um, because that's really where you have to be an expert in knowing like how to parse things later on. Because if you don't understand like the jargon that they use or the terminologies that you want to be using consistently across the city, there can be some confusion there. So that was a pretty important step in the process and just getting to know like how they track stuff, how it's sorted, etc. The third step really consisted of working with Metro Technology Services, and this was really more so like developing like the data being accessible on an open data portal. The purposes for that were so that if anybody were interested in downloading the data set that is being used on the dashboard, that is available, accessible, anybody can download that data set and really, analyze it in the way that they would like to and draw their own conclusions, so that if there's ever any, say, mistrust or, just some curiosity about like how we're getting our information or drawing our conclusions, they could do that themselves. And the final step was the I get tied up, operationalization of this, where we implemented a process where this data was updated on a regular basis. So I believe it updates about 9:30, 10 o'clock every morning. And so this allows not only ourselves, but again, nonprofit organizations to be able to get involved in the violence prevention work almost immediately. So say for example, if a homicide happened last night at 11:58, so anything before midnight really, 11:58 or 11:59, that incident would show up on the dashboard by 9:30 of the following day. And so that gives us an opportunity to be as proactive as possible when there are incidents occurring overnight or the day before, but we might not be able to know at the time or before. But this tool has allowed us to really just know on a daily basis like where's the gun violence happening. And for us as an office, that provides us an opportunity to do like engagements or activations where we come out and we just provide resources for the communities that are impacted by gun violence, and showing that we're there to support them, but also giving them spaces where they can, just have a moment for grief, or even talking to counselors, or just hear more about what our office does. So just having that tool really allowed us to be more involved when incidents happening. And I'm sure there will be some questions on this later about the accessibility and public access. But this was a major kind of step, I would say back, but also two steps forward in the process. Um, eh, I know federally there were requirements to make things all on the web publicly accessible. At the time that the original the dashboard existed, it wasn't entirely publicly accessible, based on like very technical things that our MTS team and even um, our website designers kind of went through, and they had a list of things that the dashboards or even website pages or anything that was really on the web had to include in order for it to be accessible, and that consisted of like the colors that were used, like how the um, text boxes were set up, and so we really worked hand in hand with MTS and our web design team to move the dashboard from like a Power BI, just a report itself, to a more narrative approach, uh, citywide or city website, where we now have like the control of it and are able to still have a narrative integrated into the reports, as opposed to where in the past it was just like very data heavy. This gives both like more of the academics, researchers, but also just the general public the ability to just kind of be informed on what's going on. Yeah, and so a lot of the things that we had to make sure that is included was like the translation capabilities, uh, improved accessibility by reports and visualization. So yeah, I mean those were really like just technical things that we just kind of had to learn in the process about like how to better make or how to make this figure better for like the just the public or for the eye or just more appealing. And so I would encourage that as if that's something that your cities are doing, but that's something that you kind of keep in mind early on. And I did include the link. That's more so for the resource. That's just the current dashboard where it's housed now. That's more so for when the slides get shared. Are able to go through it, or if we have questions later, I'm happy to pull it up and we can kind of go through that. But the accessibility thing was really a big deal. We were able to address everything, get it back online, almost seamlessly, and we've seen overall like just a better way of like tracking like our metric systems on like how many views, because it's now on our website. But as a whole, like this whole process, it seemed at the time like a bit of a challenge. But now looking back, it was well worth it, and it just has improved its usability in general. So looking at the place-based initiatives, as I was saying earlier, where we know that gun violence is concentrated in specific areas, uh, the darker red just indicates like a higher rate of victimizations, whereas like even the white spaces indicate like no victimizations. And this is at the census tract level. And so we know, again, this is really what we call like the area, like the West Louisville area, and that's predominantly where a majority of like shootings and homicides occur. And so, as I mentioned in the bullet point, about 40% of shootings occur within just 9 neighborhoods across Louisville, Jefferson County. Not only that was that over like the last 4 years or so, but those are the same communities that have experienced historical disinvestment and systemic disadvantages, that have led to, truthfully, like what we see now, a high rate of concentration of a high rate of violence, but also just like poverty. So it's just an area that has like historically been disadvantaged. And so what comes of that is like knowing now that where the violence is more concentrated, even within West Louisville, even at the neighborhood level, but more specifically at the census level, we can start concentrating our resources and intervention strategies in those areas, and which what we've seen to this day is that it's really maximized our impact in violence reduction efforts, but also like changing norms within our areas that we're working in. So as the data was made available, it really allowed us at the time. So the dashboard went live, I think, in 22 or 23, and then shortly thereafter, we were given the opportunity to revamp our community violence intervention sites. Um, and so what we did, my team and I, we went through all the literature. We found what was consistent with like the best practices for implementing CVI sites, how to determine which sites are best, and so on and so forth. Like the size of them, the sheer size of the actual it's the site itself, and so on and so forth. And so what we found was three areas within like the West Louisville area, and then one being a federally funded project in the Newburgh neighborhood. That's the one on the bottom right hand corner. These areas made up about 2 square miles, so they're about a half square mile per site. And while they were a small portion of the city, I think it was about less than 0.5% of the city as city's landmass, they made up about 12% of the shootings. And so again, that just shows that these areas are areas that are not only historically disadvantaged, but uh, concentrated with gun violence, higher rates of gun violence, poverty, et cetera. And so that data really made this possible. That data being available made this possible where we could really focus in more concentrated areas in very micro locations where we needed to put our efforts. And just showing some, or just sharing some outputs from the community impact of CVI. So this is how we would engage the violence interventionists themselves. So we received over 130 referrals from the to outreach. Nearly 200 mediations were conducted, and that's essentially where a violence interrupter comes up to a group of individuals where they have deemed that are either high risk or in a position where they might escalate their conflict to violence, and they mediate that conflict and they send the individuals their own ways, or make them come together and be friends. But the goal is to just mediate the conflict to where it results in not another shooting incident occurring. So over 500 individuals were involved in those mediations. And then we also had over 500 referrals to Volunteers of America. Those are for immediate needs. So, for example, an outreach referral might consist of individuals who are suspected of being the drivers of violence, whereas someone who is sent to Volunteers of America is maybe just needing like rental assistance or just needing like food assistance or just things like that, just things that were just immediate as opposed to like a long term case management. And over 22,000 high risk contacts within the community where a VI, they are experts in their community, they're credible messengers, so they know who individuals that are at high risk, and each contact counts as one. And of course, a person can be counted multiple times if they're being interacted with over the days. And so, yeah, well over 22,000 contacts have been made with high risk individuals within those CVI sites. So what we've seen over the last year, this was so really focusing on 2025 compared to 2024, but even just looking at like the historic comparisons within the CVI sites, we had a 33% reduction in the first year of our implementation. But not only that, we've had a significant decline when comparing to our peak year in 2021. So nearly 100 victims of a gun violence offense, right? Whether it's homicide or non-fatal. Whereas in 2025, we had only 45. So needless to say, yeah, we've seen great success over 1 year, but the biggest thing to take away from this is that we are seeing huge declines compared to our peak year, and we're consistently seeing declines year over year. So another thing that I wanted to cover, the accessibility of the data for anyone in the community is that you can then also make decisions based on changes in patterns of violence, right? So, for example, if after a year or two we recognize that in one of those CVI sites violence has just gone down tremendously, uh, but there's been a spike in another neighborhood, we might want to consider moving that site around or maybe consider keeping that site, but also shifting some resources to this new area, this new hotspot where violence is starting to kind of like after the first year, we had a reduction, a significant reduction in one of the sites where council felt that it may be a great opportunity for us to shift in a different neighborhood that was also in need of resources, specifically through our community violence intervention. And so that's what we did. We shifted one of our sites, but ideally you would want to keep them around. You would just maybe want to add another one, but that's neither here nor there. But the takeaway though is that having that data available really shows you when you're seeing changes in violent crime, and that giving you the opportunity to make changes as needed, which would again allow you to like just shift your resources and programming where they're needed the most. So just to kind of highlight what we were saying briefly a second ago, not only was the data helpful in showing us that maybe we should move one site around, but also that we should expand the areas. The dashed areas are the original sites, and then the yellow areas are the expanded sites or expanded existing sites. So we went from 4 sites to 6 sites after about a year or so, since we were showing significant success in having reductions in violent crime across our CVI sites. Um, so, for example, this is year to date, and again, this is building on to our year-over-year success of 25 to 24 when we had a 33% reduction. But currently, we're at a 42% reduction in homicides and non-fatal shootings within the CVI sites, and we are also at a 55% reduction in shooting incidents. Um, and that's important because, as we all know, that as we reduce the number of incidents, that by default will result in fewer non-shooting victims and homicides as well. And so, just this was a really big tool again to kind of show us like how we should go about with navigating our resources, our programming, but also like just know, like giving the public the information that they should have, right? Like they this is something that everyone should have, and so them having it allows them to be more involved. And even now to this day, we use them for. I mean, this information gets used by our nonprofit organizations that do violence intervention work or violence prevention work of any sort, where they can then just kind of determine like without us having to serve as much as like technical assistance in giving them that information where they should be, they can kind of go on for themselves and find that information and really determine like where their programming should be concentrated.
Awesome. Thank you so much, Ivan. That was really great information, and I'm really excited. I haven't had a time to, play around with the dashboard, but I'm very excited to look into it. So we'll take some time to have folks put their questions in the chat now, so we can get whatever questions you have answered by Ivan while we have his attention. But while folks are, processing and thinking about their questions, I had one question. And like I said, even though I haven't had a chance to play around with the dashboard, but thinking about like emerging trends or just thinking about the complexity of community violence, do you all have plans to, or I guess, how do you all like add additional indicators, data indicators that um, relate to current trends that y'all are seeing within your communities, whether those are indicators related to like social determinants of health or I don't know, additional information. I guess I just want to see like, do you all kind of update the trends and variables as you're seeing new things happen within your community and kind of how does that process work?
So a major part of that is just really networking within our local metro agencies. So our office is really focused on reducing gun violence specifically. But when we hear within the community that there's like domestic issues, like we reach out to the Office of Women, we reach out to like other offices because we serve more so as like as a conduit between the community and other organizations. And so not only is the data that is available helpful, but also once we are making those ties with the community and they're able to share information with us, we are then able to like kind of like move it up the chain, right? So more recently, we've been doing community walks where several of our staff just go into the same areas that we know that have experienced, disadvantage, historical disadvantage, and they just go out and they ask like, hey, what is going on in your community that could be, that we could address, that the city could address? Like, is there some lighting issues around? Just even pointing out like sidewalk, like just issues, just pointing out anything and that really are the addressing like through the social determinants, but also like our office serving as a major part in the violence prevention efforts. We do also like have a landscape. It's a bit of a framework that shows like the determinants of health, and where we want to show how everyone is also a part of the violence prevention efforts, even though they're not directly tied into it through like community violence intervention or outreach work. But public health is involved, and even the JCPS or like the schooling system is involved, and so like just showing that everybody's involved in violence prevention, even though it might not look the same for everyone.
Thank you. We have a couple of questions within the chat. So one of them says, have you managed to link data with trauma center data for gunshot wound victims?
Yeah, that's a great question. I wish we could. Unfortunately, Kentucky is a no report state, so if there's a shooting victim that goes to the hospital, um, they don't have to call the police. So a lot of times there'll be like a off duty law enforcement officer nearby that so happens like pick up on the case, and then they kind of report it to the police. But we can't do that, unfortunately. I know U of L hospital here has oftentimes when they report out like to the community that their numbers are a bit higher than ours just because of that. So, but I would say a homicide is like those are go reported. Those are by default reported to the police. So I would say really the non-fatal shootings are maybe the ones that we would be. I wouldn't say necessarily underreporting, but just underinformed. Whereas homicides, they're all captured because it's like it's a loss of a life that's going to get reported to the police. There's steps to that, and so I really wish we could do that. That's kind of like one of those kind of like goals of mine that if it were ever possible, I would love to do that. But unfortunately, with how Kentucky law works, we're just unable to do that.
Okay. And then we have another question that says, was I assume your dashboard based off of the Cardiff model?
Um, I'm I'm not familiar with that. I feel like I've heard that before. Maybe it's just slipping my mind.
Yes. I guess if Scott, if you'd like to provide additional context within the chat, or but I guess the answer would be no. Um, I don't see any additional questions in the chat. I'll give a few more, give an additional minute for folks if people are typing.
Yeah, I just kind of Googled it. I mean, yeah, based on what Scott's saying, it sounds like that's kind of like what we're doing, just maybe indirectly. Well, what we based it off of was the Chicago's the Crime Labs dashboard that they have put together for I don't know maybe 15 years ago or so. Probably the best one that I've seen out there, truthfully, with all the dashboards that I've kind of interacted with. That one stood out to me. And I found it super useful. And oftentimes I just say, if it ain't broke, don't fix it. And that's something that we just went to recreate, and we did, and it's been super helpful. It's all the information that's needed to be shared out to the community, but also it's not so convoluting where it just it creates more questions than answers.
Absolutely. Uh, any additional questions for Ivan? Okay, I don't see any additional ones in the chat. So we will move along and just kind of wrap up a bit. So I just want to share a couple ways that you all can stay connected with us. So for one, our violence prevention conference is coming up this fall, November 17th and 18th. And the theme this year is moving evidence to action and transforming community safety. So, very on brand for this webinar, and focusing on how we can use data to move forward our prevention work. And we will be opening registration next month for the conference. And also, if you're interested in being an exhibitor, we will be accepting applications for exhibitors in the next few weeks. So be sure to check our website and your emails for updates on when those things open. Also, during registration, um, during registration for this webinar, many of you listed a few challenges that you've experienced when trying to access state level data. And so I just wanted to highlight that our office is a resource for you all, and that our team is here to provide assistance with helping you use those dashboards or figuring out what data points make sense for your work. So if you're interested in getting some guidance from our office, please definitely fill out our TA form. We're happy to provide any assistance that can help support your work. And I also dropped in the chat our website link and also the subscription link for our listserv, as well as our email address. So all multiple ways for you all to be in contact with us. And lastly, we also have a data work group. And this is a work group where data professionals, whether you're directly working with data or kind of adjacently working with data, we gather those folks to talk about challenges and work through things that those folks are working on within their organizations, to help just kind of be thought partners and work through those challenges that we often face within the violence reduction and data. So that is all I have for you all. Thank you so much, Ivan. Really appreciate you sharing the dashboard and the work you all have been doing in Louisville OVP. I will be sharing the slides with everyone as well. And like I said, the recording will be posted to our resource hub within the next week or so. Thanks again.